A woman was stopped in traffic and rear-ended in her car. This is what was missed on her visit to the ER. CM is a 29-year-old woman presenting to Gonstead Spine Wellness with moderate neck pain and a tightness in her lower back and pelvis region. She reported that she has had some neck discomfort in the past, but after a recent car crash that she was involved in, the pain has been more intense and more frequent. 3 weeks ago, CM was stopped in traffic, and while she was sitting there, she felt a bit uneasy about the other drivers around her, knowing how so many other drivers fail to pay attention to their driving as they are so easily distracted on their smartphones. As she is stopped there waiting to move forward, she is staring in her rear view mirror when she notices the large SUV behind her is not looking like they're going to slow down. Boom, she's hit. Surprised at how hard the impact felt, and although she stated that she clearly saw it coming, she admits that she was in disbelief that this was actually happening. The large SUV slams into her much smaller mid-sized vehicle. Her body is violently thrown forward, and then she sits there in silence as she accepts what just happened. She immediately wonders if she should have been bracing her body harder for the impact. Once she has regained her bearings, she shrugs her shoulders, moves her head around to assess her potential injuries, and is pleasantly surprised that she doesn't feel all that hurt. She pulls her car to the side of the road, and the SUV pulls to the side as well. While they waited for the police to arrive to take a report, they exchanged information. Later that evening, CM felt a bit sore in her neck and upper back, and also a tightness in her lower back and pelvis area, something she had never experienced before. The next day, she wakes up with a bit more soreness in her neck and lower back. Still not severe, but enough that she decides she better go get checked out. She drives over to her local emergency room. They check her out, recommend taking a few x-rays of her neck, which they tell her came back as normal. They briefly have her move her head and neck around and tell her that she appears to be fine. They prescribe some painkillers and muscle relaxers and send her on her way. As the next several days go by, CM notices that she's experiencing more neck pain as she sits behind her desk at work. "I'm just sore in my muscles," she says to herself as she swallows down one of the muscle relaxer pills that was prescribed at the ER. But a few hours later, the achiness and soreness comes back, and her head begins to feel heavier. Still nothing severe, but definitely beyond any neck problem she has ever had before. 3 weeks go by, and CM is still experiencing this neck discomfort, as well as the new pain in her lower back and pelvis. And she remembers that her sister told her about a chiropractic clinic that she had gone to that helped her out significantly when she had an injury after working out in the gym. So she asked for the information so that she could make an appointment for herself. CM calls in and explains what she's been struggling with and gets an appointment scheduled. The following day, she heads over to get checked out, and this is where we are now. At examination, CM did not have any major physical findings affecting her from being able to normally walk, sit, or move throughout her visit. The nerves throughout the cervical spine were assessed by checking the sensation on the skin of the upper limbs and neck, analyzing the dermatomes, derma meaning skin, tome meaning thin segment. These are segments of skin sensation that are directly innervated by specific nerves that exit from the spine. These all checked out as normal. Further, the reflexes were assessed to see if there were any abnormalities that would indicate any other significant nerve involvement. These were normal as well. But when the doctor examined and palpated her neck, she had severe tenderness in her atlantodental region and in her mid-cervical area. Atlanto meaning atlas of C1, the upper neck vertebra, dental meaning the dens or the articulation in the C2 vertebra, the area of the neck that is involved in rotating the head side to side. The mid-cervical area or the mid-neck was tender directly over the back region of the spine. This is referred to as midline spinous tenderness, and CM was apprehensive as she flexed her neck forward. One cause of this midline spinous tenderness is a fracture in the spine, but CM was checked out at the ER. They took x-rays and said she was fine. So what could this be? One of the main roles of the spine is to keep you upright and enable you to move, bending and twisting and go through various directions throughout your life. But the other role of the spine is to act as a form of armor for the spinal cord and the spinal nerve roots, the delicate nerve tissue that runs throughout the spine to other parts of the body. The way that your body works is that your brain controls every single function in the body, and it does so by sending that energy down through the spinal cord. The skull is the first portion of armor that protects this vital nerve tissue. In this case, it protects the brain. The brain exits the skull via the spinal cord through a hole in the bottom of the skull called the foramen magnum. Foramen meaning hole, magnum meaning great. So it exits through a great hole in your head. The spine is made up of 24 total vertebrae, separated into 3 distinct regions of the spine due to their unique shape and characteristics. The first part of the spine is called the cervical region. This is the neck. Cervical from the Latin cervix, meaning neck. The second region of the spine is the mid-back region, or the thoracic spine. Thoracic from the Latin for chest or breastplate. This is the region where the rib cage is connected to the spine. The third region of the spine is the lower back, or the lumbar spine. Lumbar from the Latin lumbus, meaning loin, referring to the lower region of the spinal column. The delicate nerve tissue of the spinal cord runs down a hole through the back portion of the spinal column, referred to as the spinal canal. As it passes through this canal, the spinal cord branches off into 31 pairs of spinal nerve roots. These spinal nerve roots further branch off into even smaller nerves that transverse all throughout the body, connecting to every cell, tissue, and organ throughout. This is precisely how the brain connects to the rest of the body, and exactly how the messages and signals are carried back and forth between the brain and the other various parts throughout. The next part of the examination includes performing weight-bearing, static, full spine x-rays, meaning imaging of the entire spine in the loaded standing position versus laying down. It is not uncommon for patients to have x-rays that are performed in the supine or face-up position, which is adequate when screening for potential fractures or pathology such as a tumor, but a non-weight-bearing study is insufficient when it comes to achieving the proper biomechanical analysis of the spine, which requires the forces of gravity to be involved. In addition to these weight-bearing static x-rays, stress x-rays are obtained of the cervical spine. A stress x-ray is one that involves testing the limits of the patient's movement and then imaging the patient in that specific position. CM bends her head forward and backwards as far as she possibly can so that an image is captured in that end range. This is the gold standard method established by the American Medical Association in order to screen for something called AOMSI, or alteration of motion segment integrity. This excessive motion could indicate that a serious ligament injury is present, and it's important for the clinician to identify so that the patient can receive the appropriate diagnosis and management for their condition. The purpose of ligaments is that they attach bone to bone. They hold things together. When the integrity of the ligaments are intact, bones are allowed to move within their normal healthy range. Now, from trauma, ligaments can be stretched and torn, thus failing to properly do their job, which is guiding a joint through a safe and healthy range of motion. In other words, spinal ligament injuries are some of the most underdiagnosed and missed findings after a patient is involved in a trauma, such as a car crash, slip and fall, or sports injury. Specific protocols have been established in order to measure the total movement on a patient's stress x-rays. And if the measurement falls within the normal range of motion, then the patient does not have a significant finding. If their measurement exceeds the accepted movement parameters, then there's a grading system as far as severity that is assigned to this particular injury. In the case of CM, some abnormal excessive motion findings are discovered on her cervical spine stress x-rays. An additional specialized dynamic imaging study is performed next. This is called digital motion x-ray, or DMX, a very unique type of analysis that allows a patient to move through a full range of motion while obtaining 30 frames per second throughout the movement. This can expose crucial findings that are commonly missed on a static x-ray study. While undergoing the digital motion x-ray, another critical finding is identified in the upper cervical spine between the atlas and axis, or the first and second cervical vertebra. This finding is the excessive side slipping of C1 on C2 when CM bends her head to the left. This indicates that there's excessive motion occurring between these two segments, which means that the ligaments that hold these bones together are compromised, further explaining her symptoms and also dialing in the exact areas of her body that have been injured as a result of her car crash trauma. These findings, alongside a detailed history and full physical exam, enable the doctors at Gonstead to put together a comprehensive treatment protocol that not only helps to address and alleviate symptoms, but also get to the root cause of the problem. The findings will be thoroughly documented and relayed to the patient so she can best understand her condition. And in this case, CM had decided to work with an attorney as she was receiving a lot of pushback from the insurance company. They claim that because of the minimal amount of damage that she sustained to her vehicle, that she certainly couldn't have anything wrong with her that would require more than a couple of weeks of treatment. This is a common tactic by the insurance companies to attempt to equate the cost of vehicular damage to the appropriate or accepted amount of bodily injury. This is completely non-evidence-based, and there's no research to back this unfounded proposition that the insurance companies make. The detailed information and reporting was shared with the attorney so he could best represent and protect the interest of his client, CM, and so that she could get the care that she needed to be able to make as full of a recovery as possible. Unfortunately, when there's ligament damage to the spine, even after appropriate treatment, the tissues will never quite be the same as they were prior to the trauma. CM successfully completed a course of corrective care where she made a full recovery as far as her symptoms were concerned. She was provided with ongoing home care protocols, as well as modifications that she could make in her workplace and daily activities to minimize the chances of her suffering with severe lifelong repercussions. Her attorney was able to accurately and thoroughly represent her best interests despite the attempts of the insurance company to downplay her injuries that she sustained. So if you or a loved one has been involved in a trauma such as a car crash, slip and fall, or a sports injury, I hope this video helped give you a better idea of how important it is to have an appropriate evaluation and diagnosis. This is crucial in order for you to be treated properly and for you to make the best recovery possible. If you'd like for us to review your case, feel free to give us a call or reach out. Our information is listed below. At Gonstead Spine and Wellness, when it comes to the health of you and your family, results matter most.